Hello, how are you? Fatty plaques or atheromas that form inside the blood vessels of some people are risk factors for various diseases or health conditions. For example, they can cause problems like heart disease, even stroke, circulatory issues, and so on. So today I'm going to talk to you more about how to prevent this from happening or even try to improve the situation. Stay until the end because you won't want to miss it. If you're new here, take a moment to subscribe to the channel and turn on the notification bell. I post new videos every day with tips on nutrition, health, and fitness. You're going to love them. A lot of people want to know, after all, what exactly is a fatty plaque, what is an atheroma, what is atherosclerosis, and what's the difference between all of these. An atheroma is actually a type of plaque that is formed mainly by fat, but there are also other substances mixed in that make this fat become harder. I'll explain more about this. Normally, it starts to form due to an excess, often, of fat in the blood, but also because of some kind of injury that happens in the blood vessel. This injury can be caused by increased blood sugar, which is why people who have diabetes or metabolic syndrome usually need to be more careful with atherosclerosis. And it can also be caused by high blood pressure, which slightly damages the vessel wall. So, in order to heal this, let's say, your body starts to gather some platelet aggregation factors there to form a clot, so to speak, but it's not really a clot. It actually wants to form something that heals that area, that hardens the wall, so it becomes more rigid. So usually there's fat, usually there are inflammatory cells, there's calcium, something to make it more rigid. But over time, more and more fat can accumulate there, increasing this atheromatous plaque. And as this plaque grows and starts to block that vessel, the space where blood can flow, you end up with what we call atherosclerosis, because the atheroma, that atheromatous plaque, has grown, becoming very large. And sometimes it completely blocks the blood vessel, cutting off the supply of blood, nutrients, oxygen to those tissues. So this atheromatous plaque can keep growing over time. And I'll even tell you later how doctors usually find out that these plaques are growing, but typically people who don't have any family history and don't get regular checkups end up discovering they had an atheromatous plaque only when they have a medical emergency. So when a person ends up having a heart attack because the plaque has severely blocked the blood flow to the heart, resulting in a heart attack, or when this plaque forms or breaks off and gets lodged near arteries that supply blood to the brain, it can cause a stroke. So when people end up having some kind of related problem, they go to get checked, undergo investigations, and then realize that the person had an atheromatous plaque. Normally, as people age, they develop atheromatous plaques of varying sizes, depending on their lifestyle, genetics, and other environmental factors. But actually, what's most important is that we try to change our diet and lifestyle to prevent these plaques from growing. And it's also very important that you regularly undergo some kind of exam to check if you have these plaques, or if they're increasing, especially if you've already had an atheromatous plaque before, or if you've had a heart attack. If you've never had a heart attack but have already undergone a catheterization and had a stent placed, then you didn't have a heart attack by chance, but you could have. Because if you needed a catheterization and a stent, it's because you already had a blockage there that required the catheter to go through and clear it out, to unblock it, and to place the stent to keep the vessel open so that blood flow could continue. So, if you've already had a stroke, or if you've had health conditions related to blockage from atheromatous plaques, it's very important that you regularly see your doctor, keep getting your exams, and maintain a healthy lifestyle. So, let's talk a bit about the risk factors, about what can put you at risk for developing these atheromatous plaques. I've already mentioned that age is a factor because older people end up being more predisposed to this formation simply due to the passage of time and the accumulation of fat and calcium in the vessels of the endothelium, which are the blood vessels. So this can happen. Smoking is a major risk factor, and obesity and being overweight are also related as risk factors. Diabetes is related as well. As I mentioned before, high blood sugar can cause micro-injuries in the blood vessels. And high blood pressure can also cause micro-injuries in the vessels, which can lead to the formation of these atheromatous plaques. So all of these end up being risk factors. In addition, high cholesterol and increased blood fats are also risk factors. And some people who have certain inflammatory diseases, such as lupus or other autoimmune diseases, may be more predisposed to developing more atheromatous plaques. As I mentioned, these plaques can break off and the plaque itself doesn't cause symptoms. But if it blocks a vessel and causes atherosclerosis, then symptoms will appear, but it depends on where it happens. So if this happens near the heart, you could have a heart attack, and then you'll experience those heart attack symptoms: chest pain, pressure, shortness of breath. I have a video here that talks more about the symptoms of a heart attack and an entire playlist about the health of your heart and arteries. I'll leave those down below for you. Always remember that if you suspect a heart attack or a stroke, you need to go to the emergency room, to the hospital. It's not about calling your doctor to see you tomorrow. It's a truly urgent emergency. So, this video here is purely informational. Always remember, for any problem you think you might have, consult your doctor or go to the emergency room if it's something truly urgent. I also have a video here, by the way, talking about stroke, which is another thing that can happen if this plaque breaks off or if it's located higher up near the head in the blood vessels that supply the brain. So, these are those issues related to stroke: double vision, difficulty articulating speech, trouble repeating what was said, the person can't stand up, becomes somewhat confused. There's also a video here about signs of stroke, which is also a very serious medical emergency. I'll leave it down below in the description. So, for your doctor to determine whether you have an atheroma plaque or not, they will usually need to perform some kind of imaging exam. This exam can be a Doppler ultrasound, where a contrast dye is used to see if there is any kind of plaque near the endothelium of the blood vessel. It could be a CT scan or even a catheterization, because catheterization is an exam, but often during the procedure, when they pass that cannula with a camera, they can already see if there's a plaque, clear the blockage, and place a stent. So, all of these are ways to assess whether a person has it or not. There are other methods as well, which you can discuss with your doctor to see what works best in your case. As for treatment, your doctor, as always, will decide how to proceed. They may treat it with antihypertensive medications, medicine to lower the amount of cholesterol in your blood, to reduce fat buildup. They may use a combination of all these approaches, but it's very important that you maintain a healthy lifestyle and always follow the medication prescribed by your doctor. Of course, never change this on your own, but lifestyle is also crucial to prevent things from getting worse over time. So, let's go ahead and talk about dietary changes, because I know that's what people want to know about. To prevent the buildup and growth of atheromatous plaques, it's very important that you control both the quality and quantity of fat you consume on a daily basis. Ideally, you should limit saturated fats as much as possible. The fat from poultry skin, steak, that visible fat on meat, milk, dairy products, butter, all of these are very important to avoid consuming. Trans fat is also a highly inflammatory fat that can even increase the hardening of arteries, blood vessels, and the atheromatous plaque itself. So, it's a type of fat you should avoid consuming as much as possible. It's usually found in processed foods. We don't typically buy trans fat to use at home. Unless you buy those blocks of hydrogenated fat to make pastry dough, which I hope no one does. But usually, you'll find it more in processed products. French fries, cake, ice cream, so it's always important for you to read the label. Remember that I have a video here on how not to be fooled by food labels, and I'll leave it down below in the description for you. It's also a good idea to add fish to your diet at least twice a week, because fish contains an anti-inflammatory fat, omega-3. Fatty fish, especially sardines, salmon, tuna, herring, all of these have very healthy fats for your heart and your arteries. They are very interesting anti-inflammatory fats. And healthy fats should also be consumed, such as monounsaturated fats found in avocados, nuts, chia seeds, and flax seeds, which also contain precursors to omega-3. These are good fats that you should eat in normal amounts, as a replacement for the bad fats, which I hope you're not consuming. It's also important to mention that you should consume plenty of fiber, because fiber helps to eliminate some of the excess cholesterol circulating in your blood. So, the more soluble fiber you consume, the better it is for you. Fruits, vegetables, and leafy greens should be the foundation of your diet. Remember that I have a playlist of vegetarian recipes here on the channel, which aren't just for vegetarians. They can be a different way for you to add more vegetables to your meals if you're not used to eating them every day. So, I'll leave it down below in the description for you as well. Remember that oats are a wonderful cereal to help lower your blood cholesterol, because in addition to containing both soluble and insoluble fiber that draws out cholesterol, they also have beta-glucan, which is a natural nutraceutical that helps reduce cholesterol. There's also a video here talking about what happens if you eat oats every day. I'll leave it down below in the description. Another very interesting detail is that studies have already found that people who follow the Mediterranean diet tend to have less progression of atheroma plaque. I have a video explaining more about it here. It's a diet that's widely used in Southern Europe, very easy to follow in daily life, and even inexpensive. It's easy for you to add, modify. I'll leave the full video about it here, explaining what it's like in case you're interested in following it. In addition, niacin can also help, according to some studies, to reduce the amount of cholesterol in your blood. So it might be worth checking how your sources of niacin are, or asking your nutritionist or doctor whether it's worth supplementing or not. And some studies already suggest that garlic capsules can also help with blood pressure and cholesterol issues, which are risk factors for atheroma plaque. So remember that I also have a video here talking more about the benefits of garlic. Other things you can do to change your lifestyle and try to improve, especially one, is to quit smoking if you smoke. I know that many people who smoke are very anxious and worry about gaining weight during this time. I have a really nice video here with tips on how to quit smoking without gaining weight, and I'll leave it down below in the description for you. It's also important that you manage your stress to try to improve your health overall, and that you do some physical activity every day, at least a little. At the very least, staying more active is very important for you. This is also key if you want to lose weight, because being overweight or obese is a risk factor. So maintaining your ideal weight can also be helpful in preventing the formation of atherosclerosis plaques. It's also very important to remember that atherosclerosis is often the result of other health problems. It's usually associated with diabetes, high cholesterol, high blood pressure. So it's very important that you have regular checkups with the doctors who help you and get treatment for these conditions, so you don't develop problems related to atherosclerosis. Remember that I have videos about all of this, about high blood pressure, cholesterol, diabetes. I'll leave them down below in the description to help you, along with lots of interesting recipes as well. Tell me, have you ever had or do you have any atheroma plaques, or has anyone in your family had them? Are you concerned about this or not? I'd love to see your comment. Give the video a like, because that really helps me out, and share it with anyone who needs it. Let's work together to grow this chain of good. That's what I want here on the channel. See you next time. Bye.